Hi, my name is Rosalie. I am owner and director of Enhance Cosmetic Solutions Limited. I have been a nurse since 1985. I'm a specialist nurse practitioner and I began my aesthetic career in 2009. In 2016 I became Care Quality Commission regulated and now specialise in non-surgical facelifts, otherwise known as PDO Thread Lifts. Today we are going to focus on non-surgical facelifts, although I do other injectables as well. And like and follow my page if you would like to see more of what I do. My name is Rosalie. My patient today is Jane. We have had an in-depth medical consultation and Jane has had thread lift treatments with me before. So today we're not going to do a full facial thread lift, we're just going to do the neck and the jawline. For the purpose of this video, Jane has brought along questions that she's asked me before, and these are all frequently asked questions. So Jane, would you like to go through your list and ask the questions that you feel that you'd like to know the answers to?
Yeah, so how effective would you say a thread lift is in respect of a surgical procedure? So a facelift that you would have as a surgical procedure as opposed to a thread lift, what's the difference?
Well, the difference between a surgical procedure, facelift, and a non-surgical is that I can't cut away excess skin. I don't use a scalpel or a knife, I use a needle. And so I am limited by how far back you can pull the skin because I can't remove any. That said, by just tweaking the skin back, up like this, you do create a very effective result, but I cannot remove excess skin. So actually, to be honest with you, it prevents the wind tunnel look anyway, because you can only go back so far. So that is the main difference.
And is it safe?
It is very safe in the right hands. So you have to be medically qualified, you have to be experienced, you have to have done the right training, you have to be regulated by the Care Quality Commission. I am also on consulting rooms and approved by consulting rooms, which is kind of like checktrade.com for aesthetic practitioners. So it is an extremely safe procedure in the right hands, but I will say a very unsafe procedure in people who are not qualified and regulated to do it.
And what are the risks?
There are very few risks with somebody who knows what they're doing. So in terms of side effects, which are expected things to happen, you can expect some bruising, you can expect some swelling. It may be uncomfortable for up to a week, but you can take paracetamol. So they are expected side effects. There is a small risk of infection, but we counter that by using one-use only equipment, a sterile environment, and I also give prophylactic antibiotics for 3 days. Prophylactic meaning just in case antibiotics. I've never had an infection in one of my patients in any of my treatments, but particularly in thread lifts, I've never ever had an infection happen. So there is a very, very small risk, but because the holes are so small and they close up so quickly, it is minimal. One thing that you need to know is that you can't fully correct significant asymmetry, but you don't make it any worse. It's just that some people may expect that they would have completely symmetrical faces following a thread lift, whereas in fact if they were asymmetrical before it was significant, then we would rectify it to an extent. So we're not looking for perfection, we're looking for massive improvements.
And is it painful?
The most painful part is the numbing process. So I use local anaesthetic, and it's the same anaesthetic the dentists use. It's called lignocaine, 2%, and although the injections are very, very tiny, they're the size of insulin needles, they can be stingy. But that process is very quick, and once that has happened, then you don't actually feel any pain from the procedure. You can feel some odd sensations because you can feel the threads going in, but they don't hurt. A bit like going to the dentist, you can feel the movement, you can feel some popping going on as we attach the skin to the thread, but you don't actually feel any pain from the thread lift procedure itself. And if you do, then it is minimal.
And how long does it last?
Well, it really depends on somebody's age, skin integrity, lifestyle, if they sit in the sun without SPF, if they smoke a lot, if they basically live in an unhealthy lifestyle, then it's going to last a lot shorter time. But with the moulded threads that I use, I'm seeing results lasting for 2 years plus. I had my thread lift 2 years last March and it's still holding well. So depending on what type of thread you use and depending on the patient's integrity, skin, age, environmental factors, it can last for up to 2 years. So as with yourself, you've had a thread lift 2 years ago and now you're just looking to have the neck and the jawline topped up. So some of it is still holding well.
Mm-hmm. And what areas can be treated?
The most common areas are the mid-face, the jawline and the neck. I straighten and lift a lot of noses. People like the fox eye lift look. It's not something I'm a fan of, but I am trained in it. But also what's very common is eyebrow raises with using PDO thread lifts.
And can you feel the threads once they're in? Can you feel it after you've had the treatment?
For a few days afterwards, you can feel, because they're a little bit sore, you can feel that there is something there because you've got rough areas on the threads, which is what the skin holds the skin in place. So you can feel it for a few days, but once they're fully buried into your own tissue, then you can't actually feel them and you can't see them from day one. Nobody can see them, but you may feel that you've got something in your face for a few days, which is a little bit tender and uncomfortable.
And how long have you been doing threads?
Thread lifts I've been doing since 2016. I have done several courses, including an advanced course. I've done many threads since that time. I've developed and formulated and grown on my products and my techniques. I mean, the products that I use today are so much more refined than the products I started using in 2016, and the industry is producing better quality products as we go on.
One other question would be, have you ever had one that's not like somebody's regretted it, have said there's no difference? I mean, do you have any patients that can't see much of a difference and regret having it done?
I've had one person who was hoping for a better result than she got. Mm-hmm. She didn't regret having it done, but I think she perhaps had expectations that were way above what we were going to be able to create. I try and manage people's expectations really well, and therefore, apart from that one person, I've never had somebody who's regretted having it done. I've always had people who are delighted with the results, and you get your initial result, your initial mechanical lift, and then for 12 weeks after, it continues to improve and produces elastin and collagen. So by the end of 12 weeks, you've got a much better result than you started with, and after 5 months, the threads completely dissolve, so that all you've got left in your face is your own natural elasticin and collagen. It doesn't stop the aging process because the aging process is dynamic, but the results can last, as I said, for up to 2 years.
And have you had anybody have more than one thread lift? Have you had anybody come back and have another one?
Yes, I've had a lot of people coming back after 2 years to have their next one. So I've had people who are on their 4th thread lift.
Wow.
Yeah.
Good, thank you.
Okay, so Jane has been thoroughly cleansed with Clinicept, and she has had LMX4 numbing cream at the point of the lignocaine that we're about to insert. I'm just marking up the area where we're going to be numbing. we're going to be doing the neck, the jawline, the neck, and coming across into the marionette area. I'm also going to be putting in a multi-thread into each nasolabial. And these are the points that we're going to be numbing. So if you just return to me. Just here. Okay, so just turn yourself back. You okay, Jane?
Yeah, it's fine.
All right. So the numbing injections, the local anaesthetic, are quite stingy. The needle is very, very small, as you can see, but they can be a little bit stingy. But once we have done this, there is no pain or discomfort to the patient. There's just a bit of tugging and pulling feeling. So I'm just going to pop in your local anaesthetic, Jane. Okay. Is that a little bit stingy?
Not yet.
Okay.
A little bit now, but
All right.
just a little bit. It's not uncomfortable, just a bit
Okay.
stingy.
Excellent. Okay, so just going to pop a little bit into the nasolabial. And when we have done this, while we're waiting for the local anaesthetic to work, I will be marking your face. Just change the barrel. And replace it. There you go. Okay. Right, so how are you feeling, Jane?
Feels absolutely fine. Felt a little bit of stinging, but yeah,
Excellent.
it's fine.
Okay. So what we're going to do now is we're going to mark the areas that we're going to place the threads. So the thread vector we're going to have across the jawline, into the neckline, and just above, so we can catch some of the marionette fold, and as I say, a multi-thread into the nasolabial. So just there. Okay. And okay. Just turn your head slightly that way for me. Excellent. There we go. And just turn your head this way for me. So these are the vectors that we're going into. I'm just marking down the middle because we don't go past that middle point with the thread. Okay. So I'm just going to clean over the top of those marks.
So what is a vector?
The vector is just the area that we're trying to tighten.
Okay.
So we've got the nasolabial fold here, and obviously the jawline, and the vector is the area that I'm basically, in layman's terms, that I'm putting the thread into. So I'm just dabbing the markings because I want to keep them as clean and sterile as possible without obviously removing them. Now, everything that we're using today is a one use only and gets discarded. And as I say, you've basically had your antibiotics and your face has all been cleaned. So what I'm going to do now is I'm going to see whether the lignocaine has worked yet or not. How is that?
Can't feel anything.
Can't feel anything, so you should feel pressure but no pricking.
No.
And what about this one?
No, can't feel anything.
Okay, well done. So what I'm going to do now is I'm going to get you to turn your head as far to the side as you possibly can. Okay, so I'm just going to make my entry point with an 18 gauge needle, and you shouldn't be able to feel that at all.
Can't feel anything.
Excellent. So I'm just going into each vector to allow the cannula, which is blunt, to slide into the area that I wanted to slide. Okay, so keep nice and still because you've got a needle in there. What I'm going to do is I'm going to use a mini cannula with some local anaesthetic so that I can flood the area so that it is numb as the threads are going into it. So a little bit of a strange sensation. So this is just going to make it as comfortable as can be. But again, because it's local anaesthetic, it will be a little bit stinging. Okay, well done. You all right there, Jane?
Yeah, it's fine.
Okay. Sometimes you can get a little bit of a resistance. Okay. Just going to draw that small and pop some into the nasolabia line so that we can numb the end point of the thread. Okay. So again, just want to check, Jane. Can you feel that?
No.
Okay, so a little poke coming in. What I'm going to do here, you just turn your head a little bit. I'm going to find the hole. There you go. And just go down into the area that your thread is going to end. There you go, a little bit of stinging. Okay, well done, well done. Now, while I'm in this area, I'm going to pop in one of your multi-threads, okay? Just turn your head this way for me, well done. Now this doesn't have any cogs on it. It's got multiple threads on it, and it basically stimulates elasticin and collagen in this area so that you don't have that hollowing. Now, apparently it takes up to 12 weeks to work, but everybody I've ever done one on has always said that they can see the result straight away. So, and I can actually see the result of that immediately. So that is good. Okay. So if I could just get you to turn your head again, Jane. Well done. Now we're going to be putting in your first thread into the subdermal layer. bevel up. There you go. Now you might be able to feel the pressure, but you shouldn't feel any pain. Always checking where the end of my thread is to make sure we're at the right depth. Sometimes as you get to the chin area, it can be a little bit uncomfortable, but I have numbed that area, so hopefully it will be minimal. Okay, well done. So we don't have to use the whole of the thread because what I'm using is 19 gauge 100mm in length, which we don't need to use the whole of it. So I'm just going to twist. This is the end of my thread. I'm just going to twist, and then I'm going to bring it back, just walk it out gently. There you go. What you've got is your first thread in place there. And if I just pull there, you can see that the thread is fully attached and it's going to lift that beautifully. So into the same hole, we're going into the next point. Again, bevel up. You can put up to 4 into each insertion point, but I tend to put a maximum of 3 because these moulded threads, there's different types of threads. There's fine threads, there's multi-threads, there's screw threads, and they're all designed for rejuvenation. But the cog threads and the moulded threads are for lift as well as rejuvenation and stimulating elastin and collagen. But what I've found is that the moulded threads are particularly sturdy and have good longevity. And so at the moment, alongside the multi-threads, I tend to use these ones most of all. So again, twist, and we just walk out your thread. Okay, so that's 2 threads in. We've just got 1 more thread. You're doing really well, by the way.
Can't feel anything. You can't. You
Good.
can feel a bit of tugging, but
Excellent.
no pain.
Excellent. So, if I could just get you to turn a little bit to the side. Well done. Okay. So sometimes in the neck area, there can be a little bit of resistance. Once we get past it, because it's blunt. Let's just go in here again. It doesn't pierce anything, so there we go. Once we get past it, it's fine. So there's the end of my thread. We don't go past the middle point line here, so I can see it all times. There we go, last point. So again, we've still got some thread left. We're just going to trim it. So just twist, out we pull. Fantastic. So that is all your threads placed into one side and your nasolabial. And if I pull, you can see the lift. Okay. So what I'm going to do is use my sterile forceps. Give them one little twist, and then I like to, with my sterile scissors, I like to just bring them upwards so that I can cut it as close to skin as possible and bury the threads. Now before I do that, could you just give me a smile and frown for me, just to make sure that there is no rippling, which can happen and settles down very quickly, but it's better if we don't get any. So I'm just going to go as close to the skin as possible, trim that. There's your thread remainder. And then I'm going to get some sterile gauze and just properly bury that in. Now you might feel a popping noise as I'm lifting the skin over the top of the thread, but that is looking amazing. You've got a lovely firm jawline. Can you hear, can you feel the popping?
You can feel it a little bit, yeah.
It's quite satisfying because you know what you're actually doing.
You can hear it more than feel it?
Yeah. Like I can actually feel it because I'm massaging across the skin. It's really satisfying because you know that you are getting a really good lift. That is your skin lifting onto the thread. Now I use arnica just to massage it in so that you get a good head start with your lift. Is that uncomfortable at all?
Not at all.
Sometimes if the thread isn't fully embedded and it's sitting on the top, then it can be a little bit sore, but
I can't feel anything at all.
This gives a good start to your lift and helps to bury them all into place. And obviously arnica is good for bruising as well, but it stops the friction to the skin. So there you go, just smile for me. Now if you turn your head, you can see that literally all that Jane has got is that insertion point here, which I'm going to put on some antibacterial cream and a spot plaster, which you will leave on for 24 hours. Jane has received all the aftercare, both verbally and by email, and obviously we've done a full medical consultation. But for the purposes of this video, we haven't actually captured that. There you go, so that's one side done. So we're about to start the other side. I have checked the local anaesthetic has fully taken. Jane can't feel anything at the entry point that I'm about to puncture to place the thread. So we're going to get Jane to turn her head so she's facing the other way so that I've got some tension to be able to put the thread in. Jane is all cleansed and sterilised, ready for the other side. And let me just check, Jane, can you feel that one?
Can't feel anything.
Okay. So, just a little poke. And as you will have seen from the other side, there is virtually nothing to see in terms of downtime, apart from minute little holes. So, as with the other side, I am just preparing thread path with the needle along the thread. And then I'm going to do the same as I did the other side and into the end point of the thread so that it is more comfortable. Now obviously that does make you, it feels like you've been to the dentist where everything just feels a bit floppy and numb, but it does soon wear off. Let's get that one in because I'm going to track, so I'm just going to make a little track there. There we go. Okay, let's try again. I haven't always done this because the more local anaesthetic you put in, the more puffy it will be for the first couple of days, and obviously you have the inconvenience of feeling a bit numb for an hour. But there have been people in the past who have found it a bit uncomfortable at times, and so we prioritise comfort over that little bit of inconvenience, which most patients would opt for. They do get given the choice, by the way, at their initial consultation. They do get given the choice of whether we want to fully numb it or not. But I'm finding more and more that people are opting to be completely numb.
I've not felt anything.
Well, you've had, this is your third one now, isn't it? Would you say that the pain relief in this one has improved to your very first one?
Yeah, completely numb this time, whereas before it was numb but a little bit uncomfortable, but I can't feel anything at all. I feel completely numb, and like you've been to the dentist, like you can't talk properly because it's numb.
Well, I think that would be reassuring for a lot of people, because most people are worried about having pain. So thankfully we've achieved what we set out to achieve. So little folk, this side is a lot tougher than the other side. So you can see my end there of the multi-thread, and hopefully you can see from the photo, from the video, the improvement on the other side. So a little twist, and then we take it out. And this will continue for up to 3 months to produce that beautiful elasticin and collagen we all so desperately crave, so that we can stay as young and youthful looking as possible. So once again, bevel up. We're going into the mid-dermis, following the line, and I can see at all times the end of my thread. Now, if it was going to be uncomfortable, it was at this end point that it would have happened, but because we've numbed it, that's not happening, which is fantastic. You can see the end there. I'm just pulling back a little bit, little twist, and out we come. Okay, well done. First thread in. We're going to go into the same hole, work towards the marionette area. There we go, and again, still using 100mm 19G, so we're not going to go all the way in. We're going to trim some of that thread. There we go, and we've just got one more. To go into the upper neck, just here, and again you can see the end of the thread, and we're not going past the midpoint line, which is here. Little twist, and out we come. Perfect. Now, just to say that if we were doing a mid face as well, I'd have made an entry point here and an entry point here, and I would have been putting a thread straight into the jowl area and into the heavy area here to lift it up, and then I'd have had another insertion point around here, and we'd have been putting it into the nasolabial, and again another one into the marionette. So that would have been a full thread lift, or we could have just done that as a mid thread lift, but we have done the jawline and the neck. So basically that is all of the threads in. So I'm just going to use my clamp my forceps, and if you could smile for me, Jane, and frown. So we've got no dimpling or rippling there. I'm going to hold all of my threads, give them a little twist, and then with my sterile, one use only scissors, cut very close to the skin and bury the threads, and that is where you can hear and feel the clicking going on. So what I'm going to do now is just clean off the markings with Hibby Scrub. And the final thing I'm going to do is to just get behind Jane, and using my arnica, which I use on the other side, I can now freely, without any hindrance of threads or anything else, freely just massage that area to give it a really good head start. And looking down from here, I can see the huge improvement and the tightening in the areas that we've treated. Now, some people don't give as much of a massage as me, but it is really nice for the patient to be able to see as much of an improvement on the day as possible, because over 12 weeks, whilst it significantly improves, it's a very gradual improvement, whereas this, as you can see, is instant. So there we go. No evidence of any threads whatsoever. I can't see a single bruise. There we go, all done. So Jane, 1 week on from your treatment, and I can see immediately the tightening in the jawline, the softening of the marionettes, and also the nasal labia. I can see you have got a little bit of yellowing just along here, but no, and a little bit there, but no significant swelling. So that's what I can see. And how are you feeling?
Yeah, really pleased with it. It's been a little bit sore just along this jawline, but nothing that I've needed to take painkillers for, or just a little bit sore. Just a bit like when you've been to the dentist, you know you've had something done, but I'm really pleased with the results so far.
Good. And has anybody noticed?
I've had people say, oh, you look good, but they can't identify why, which is a good thing.
Yeah.
But yeah, quite a few people have said, oh, you're looking good today. But so yeah, people notice but can't identify what, which is a good thing. That's the result I want.
Excellent. So prior to this conversation, I did have a little feel, didn't I, around your jawline. There's nothing visible, nothing palpable, and I'm very happy. Everything is going in the right direction. We've still got 11 weeks of improvement to come yet, which is great. So I will see you again, if you're happy with that, in 6 weeks. Monitor your progress, and see you again in 12 weeks when the final progress has taken place, to see how you're getting on. Is that okay?
Perfect.
Excellent.